Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor NIEHS. Welcome to our COVID-19 exposure recognition model addressing infection transmission. The goal of this lesson is to prevent potential exposure to COVID-19 by understanding the biology of the virus, how and why the virus is transmitted, environments resulting in the likelihood of exposure to the virus from high to low, and what kind of precautions should be taken to prevent infection. SARS-CoV-2 is the virus that causes the coronavirus disease 2019, or COVID-19. COVID-19 spreads easily person to person, particularly when someone sneezes nearby, releasing respiratory droplets and aerosolized particulates that are absorbed by the nearby parties. However, a significant segment of the population has been linked to an asymptomatic spreading of the disease, which means that the spreader does not demonstrate observable symptoms while being contagious. As of this publication, no significant spread of COVID-19 via touching an inanimate surface or ingesting a food source has been substantiated. Symptoms may appear 2 to 14 days after exposure to the virus. COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other within 6 feet usually. People who are infected but do not show symptoms can also spread the virus to others. Cases of reinfection with COVID-19 have been reported but are rare. We are still learning about how the virus spreads and the severity of the illness that it causes. How easily a virus spreads from person to person can vary. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to infect people. People who are physically near or within 6 feet of a person that has COVID or have direct contact with that person are at greatest risk of infection. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce respiratory droplets with the virus. These droplets can range in size from large droplets, some of which are visible, to smaller droplets. Small droplets can also form particulates when they dry very quickly in the airstream. Infections occur mainly through exposure to respiratory droplets when a person is in close contact with a person that has COVID-19. Respiratory droplets cause infection when they are inhaled or deposited on mucous membranes such as those that line the inside of the mouth and nose. As the respiratory droplets travel further from the person with the COVID-19, the concentration of these droplets decreases and infection decreases. Large droplets fall out of the air due to gravity. Smaller droplets and particulates can spread apart in the air. Some infections can be spread by exposure to virus in small droplets and particulates that can linger in the air for minutes to hours. These airborne virus transmissions may be able to infect people who are further than 6 feet away from the person who is infected or after that person has left the space. This can be true when the enclosed spaces have inadequate ventilation and infected people breathe heavily while singing or exercising. The CDC is aware of a small number of pets worldwide, including cats and dogs, reported to be infected with the virus that causes COVID-19, mostly after close contact with people with COVID-19. At this time, the risk of COVID-19 spreading from animals to people is considered to be low. The best way to prevent illness is to avoid being exposed to this virus. Stay at least 6 feet away from others whenever possible. Cover your mouth and nose with a mask when around others within 6 feet. Wash your hands often with soap and water. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Avoid crowded indoor spaces and ensure indoor spaces are properly ventilated by bringing in outdoor air as much as possible. Stay home and isolate from others when sick. This is a mini quiz. Please answer the following 2 questions. A COVID-19 spreader must demonstrate observable symptoms to be contagious. True or false? A COVID-19 spreader can be contagious beyond 6 feet in a closed indoor environment. True or false? In conclusion, stay at least 6 feet away from others whenever possible. Cover your mouth and nose with a mask when around others. Wash your hands often with soap and water, and if soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Avoid crowded indoor spaces and ensure indoor spaces are properly ventilated by bringing in outdoor air as much as possible. This concludes module number 2. Be safe and thank you for your time.